Good morning. This is what I hope to be the first of many chats about hormones and hormone replacement therapy. This one's for the women, but I really hope you guys stick around too, because if you know a woman, have a woman in your life, a woman that you love, it's really important that you have basic understanding of this knowledge, and your support just really helps health outcomes for the women in your life. So hopefully you learn something and you like it. For those of you that don't know, I'm an integrative compounding pharmacist. We mostly compound bioidentical hormone replacement therapy for women. This is not meant to be medical advice, but I do hope to arm you with some information that you can better equip yourself to speak to your provider and have a bigger role in your healthcare and not feel so helpless. There's a lot of misinformation out there, and that's largely what this video is going to be about. So most of the things that I'm going to talk about in this video come from Dr. Bluming's book, Estrogen Matters. It's phenomenal. I highly recommend it. He's got a great podcast, a lot of great podcasts, but one with Peter Attia that I highly recommend if you're interested in the topic. But I am going to start in 1966 with Robert Wilson, who wrote the book Feminine Forever, which he basically said that when you're going through menopause, it's living decay. And if you want to make your husband happy and look beautiful and feminine forever, you should take estrogen hormone replacement therapy. He largely overstated the benefits of hormone replacement therapy. It was later found out after his death, when his son disclosed that he was being paid by the pharmaceutical industry to make these claims. You can imagine that during this time there was a big pushback from the feminist movement saying, I don't need to have estrogen in my body to be a woman, and they kind of took on this role where you just have to live with it and deal with it the same way as you did when you went into puberty. So I think that was like the real first, at least when I'm looking at it, pushback against hormone replacement therapy. That's kind of where it started. And then we move into the Women's Health Initiative study, which was this huge billion-dollar study that was published in 2003 that said if you take hormone replacement therapy, there's an increase in breast cancer, there's an increase in heart disease. They stopped the study early, they ran to the press, and millions of women threw their hormone replacement therapy in the trash overnight, and it was huge issue for women's health around the world, and like in an instant, basically. There's a lot of issues with this study that I would like to get into. The first is where I disagree with Dr. Bluming. The hormones that they used were synthetic chemicalized hormones from pregnant horse urine and other sources. I believe in the use of bioidentical hormones, which is why we compound them at our pharmacy. Dr. Bluming still believes in the use of synthetic hormones because there's more studies done on them, which I disagree with. But that was one issue with the study. The second issue with the study was the population. The population was, on average, 63 years old, which is 10 years older than the average woman in this country goes into menopause. Also, 70% of them were overweight or obese, and more than half of them were smokers. So you had a very sick, elderly population, and to give them credit, they were really trying to see whether hormone replacement therapy affected heart disease or not. And with an older population, you can tell more quickly whether or not you're making a difference. But then the issue was they extrapolated that data to a younger population. We now know that if you wait 10 years after menopause to start taking your hormone replacement therapy, there is an increased risk for a short number of years after you start of cancer and heart disease. When you correct for that and you only take the women who started taking their hormone replacement therapy within 10 years of hitting menopause, that risk was eliminated. There's a decreased risk of heart disease, a decreased risk of breast cancer. Now we have what I believe to be the biggest issue with the study. There was 4 groups, but one group testing estrogen alone, which is women who without a uterus, estrogen alone against a control group. And then you had another group that was estrogen plus progesterone, which you need to take if you have a uterus, against a control group. And they found that the estrogen only group had a decreased risk of breast cancer when you compare it to the control group, and that the estrogen and progesterone group had an increased risk of breast cancer when you compare it to the control group. What is very interesting is the estrogen group and the estrogen and progesterone group had the same exact risk of cancer. So it doesn't really make any sense that you would say one is risky, one is not, when they had the same results. When you go through the data and you figure out what happened, the control group with the estrogen and progesterone had a lower than average risk of cancer. And you ask yourself, why is that? Why did those people have a lower than average risk? A lot of the women that ended up in that control group were randomized into that control group, but a lot of them were on hormone replacement therapy before the study started. To give the benefit of the doubt, not a lot of women were on hormone replacement therapy compared to the whole population at that time, but nonetheless, when you correct for that, there's no risk in breast cancer. Another ridiculous issue in my opinion is that they excluded symptomatic women from the study because they were worried that if they were in the control group they would drop out. They excluded symptomatic women and then said there was no benefit to quality of life. So you basically exclude the women that could benefit from quality of life and then say that there's no benefit in quality of life. And if you talk to any woman that's symptomatic, not everyone is, but the women who are symptomatic going through menopause, and tell them that their quality of life is not improved on hormone replacement therapy, they would laugh at you. It's ridiculous. But the New York Times published that hormone replacement therapy causes breast cancer and doesn't even improve quality of life. So it was a sad day. Furthermore, there was 40 investigators in the study. 3 of them were on the writing committee for the paper. And when they canceled the study, the 3 writers told the other 40 members from around the country that they had to all come in to talk about the paper. They said they had 3 hours to voice their concerns about the study. At the end of the 3 hours, they said, it's too late. The study is going to the papers. It's going to the journal to be published. So it was definitely, the study was not conducted in such a way that it really should have been. Another issue was that the study was not statistically significant. The results were not statistically significant. And when Dr. Bluming invited one of the 3 writers to his hospital to speak afterwards, one of the doctors in the audience asked, why was this published without statistical significance? And he said, this was $1 billion study. We're never going to be able to replicate the study at this magnitude again. If there's results to be found, we need to find it. The statistics police need to leave the room. And the statistician in the study stated, when it's an issue as important as breast cancer, we set the bar low. So basically, they did not conduct themselves the way that you should conduct yourselves when conducting scientific studies. And their excuse was, this is breast cancer, it affects too many women. We have to let these results be known immediately. And they misinterpreted the results, and it hurt a lot of people. So those are the issues with the Women's Health Initiative, and I would like to talk about some of the benefits of hormone replacement therapy. Hormone replacement therapy right away relieves symptoms of menopause. And what is menopause? It's when a woman's hormones rapidly drop. Their estrogen drops from normal levels to 1% of their normal levels rapidly within about 6 months or so. This is much different than male hormones, where their testosterone decreases slowly over a long period of time. And you might think, oh, it's a year or so, right, of going through menopause, but on average menopause lasts 7 years, and it's even longer for women of color. So there's a long time to deal with symptoms. If you're a symptomatic woman going through menopause, you might think it's only hot flashes and night sweats, but it's way more than that. It's heart palpitations, it's cognitive decline, which is significant, especially if you like to do cerebral activities like reading books and things that really maintain your quality of life, and you can't do those things anymore. Sleep disturbances, abdominal weight gain, muscle and joint pain. I'm not just reading a list of symptoms. These are real symptoms that women suffer through, and I don't use that word lightly. And these symptoms are resolved within 2 weeks a lot of times when you go on hormone replacement therapy. So it's a big deal. It helps a lot of women. Furthermore, it decreases heart disease up to 50% when you're on hormone replacement therapy. So to a lot of people will say, oh, I'm not worried about that. Breast cancer is a disease of younger women. Heart disease is a disease of older women. I don't have to worry about that. I don't want to be on hormone replacement therapy if I could get breast cancer. But within every single decade of life, your risk of dying of heart disease is way more than breast cancer. It starts at like 4 times more likely, down to 2 times, up to 9 times as you get older, way more likely to die of heart disease. So if you can decrease your risk of heart disease by up to 50%, it's a big deal. It decreases the risk of osteoporosis and hip fractures. When you take the deaths caused by hip fractures, and by that I mean if you have a hip fracture, fall, and then die within the following year, so not necessarily cause, but there's an association there. More people die of that every single year than everyone dying of breast cancer, which is huge. You're taking an elderly population and comparing it to a whole population of people dying of breast cancer. It's way more significant, and those risks drop when you take hormone replacement therapy. Alzheimer's is another big one that affects women way more often than it affects men. And estrogen is protective. It's protected to the brain, it's cardioprotective, and it decreases the risk of Alzheimer's. Bioidentical versus traditional chemicalized hormones is a video for another day in another book, but that's a big difference between the types of hormones you can take and their effects, their negative effects. So the moral here that I'm trying to get at in a 15-minute video today is you don't need to suffer because you're scared. That's a big misconception. You should talk to your naturopath, your open-minded conventional doctor, your integrative medicine doctor, and check out your options, because there are many. I hope you guys have a great day. I hope you like this. I'll talk to you tomorrow. Bye.